you will move on to the next talk by Ronit Koren, the effects of hyperbaric oxygen therapy on glucose levels in diabetic patients, neurological patients, and healthy volunteers. Ronit, please.
Okay, hello. Good day to everybody. So my name is Ronit, and I'm an attending in an internal medicine ward in Asaf HaRofeh. This work was done as a part of my residency there, and I have the honors to present it to you today. And as was read before, the title is The Effects of Hyperbaric Oxygen Therapy on Glucose Levels in Diabetic Patients, Neurological Patients, and Healthy Volunteers. Now, in the common practice of hyperbaric medicine, it is a well-accepted phenomena that blood glucose levels decrease during the therapy. But is it really true? Does hyperbaric therapy really reduce the blood glucose levels? So we went to the literature and looked. We found only few studies that have evaluated this effect. And most of these studies have been small, unconvincing, most of them conflicting, and almost every one of them was uncontrolled. I will give you a few examples. In this study, a study in rats, after an induction of cerebral ischemia, hyperbaric oxygen therapy was found to reduce the blood glucose levels and improve the glucose extraction in the brains of rats. Here a study in diabetic divers that evaluated over 500 dives that found that glucose level decrease in diabetic patients after diving. A small study in 2001 in five diabetic patients and 5 volunteers found that there was a decrease after hyperbaric oxygen therapy, but only in the diabetic patients, not among the volunteers. Yet another study that also evaluated diabetic patients with and without hypertension found a statistically significant decrease in the blood glucose levels. This study was uncontrolled. From a different point of view, maybe a different angle, this was a Polish study, a long-term one, that found an improvement in metabolic profile of the patients, in the hemoglobin A1C levels, the lipid profile, the insulin sensitivity. This was following 6 months of hyperbaric oxygen therapy. As I said, the studies were not all the same, and here are a few examples. This was a small Japanese study in diabetic rats that found an increase in the blood glucose levels after 6 weeks of therapy, and a couple of other studies that reported that rats with or without diabetes had no change in their blood glucose levels after the hyperbaric oxygen therapy. So after all this information, we've decided to conduct this study. Our primary endpoint was to evaluate the effect of hyperbaric oxygen therapy on the blood glucose levels in patients with diabetes, CVA or TBI, and healthy volunteers. We also wanted to see the effects on the blood pressure, the temperature, and the heart rate of the patients during the therapy. So the patients were recruited from the population treated in the Hyperbaric Institute in Asaf HaRofeh, and participants were of 3 groups. First, diabetic patients treated for their non-healing wounds. Second, patients treated for their neurological deficits, patients with CVA or TBI, and healthy volunteers. Of course, we excluded all the patients who couldn't or wouldn't sign an informed consent, and all the other patients that couldn't undergo hyperbaric therapy for all the other trivial reasons, such as chronic lung disease, pregnancy, etc. Patients were evaluated in 2 different sessions that happened up to 2 weeks apart. The first session was a standard hyperbaric oxygen therapy that lasted 2 hours, and the second session was a control session. It took place in the Hyperbaric Institute. It lasted the same period of time, but there was no elevation of pressure nor oxygen supplementation. All participants were instructed to have a meal of around 300 calories, 2 hours prior to each one of the sessions, and of course to continue all of their regular medications. All diabetic patients were instructed to continue their insulin therapy and their oral hypoglycemic. So I would just like to emphasize this. The patients had two identical meetings, identical meals, identical evaluation that lasted for the identical time. Only one session was a hyperbaric therapy session, the other was in room air. Each evaluation included measurements of body temperature, of heart rate, of blood pressure, and we also took whole blood for glucose levels and PCO2 levels. These were made 3 times. First time was at the beginning of each session, next time after 1 hour in the middle of the session, and for the last time at the end of the session. And as I said, each patient served as his or her own control. We had till now 31 patients, 15 volunteers, 13 patients with diabetes, and 5 patients with neurological deficit. We are still recruiting currently to the study, so hopefully it will get larger. So the results are for the whole group, for the whole 31 patients. And this table, you can see that at the beginning of the sessions, there were no difference at all between the sessions in every one of the parameters. So the starting point was exactly the same. What happened after the hyperbaric therapy? So we can see a significant decrease in the heart rate from 75 beats per minute to 69 during the 2 hours of therapy, and a strong trend in the glucose levels, a decrease from 134 to 123 with a p-value of 0.07. So it seems as if the hyperbaric therapy does have some kind of effect on the glucose levels. But let's see what happened in the control session. In the control session in the room air, we were surprised to find exactly the same results, a decrease in the heart rate, and a strong trend towards a decrease in the glucose levels, again from 75 to 71 beats per minute, and in the glucose levels from 135 to 125 with a p-value of 0.06. When we compared the 2 sessions, we found that after 2 hours of hyperbaric oxygen therapy, there was a decrease in the heart rate for 6 beats per minute. After 2 hours in the control session, the decrease was of 4 beats per minute, and there was no statistically significant difference between the 2 descents. Same with the glucose levels. You can see a decrease by 10 milligrams per deciliter during the hyperbaric oxygen therapy, and a decrease of 9.35 during the 2 hours of the control session. Again, with no statistically significant difference between the 2 descents. So when we evaluated each group by itself, the diabetic group, the neurological group, and the healthy volunteers, we saw that there is no difference, so I didn't put in the whole data. So this study evaluated the effect of hyperbaric oxygen therapy on the blood glucose levels, the body temperature, the heart rate, and the blood pressure and PCO2 levels. We did find a decrease in the heart rate during the therapy, but also a decrease in the heart rate in the control session in normal baric environment. The decrease was similar, with no statistically significant difference between the sessions. We also found a strong trend towards a decrease in the blood glucose levels during the therapy and also during the control session. Once again, with no statistically significant difference between the 2 descents. I just have to say that the small study group and of course the heterogeneity of the patients could have influenced our results, and the improvement in the metabolic profile, especially the hemoglobin A1C levels that were witnessed in other studies, could result from other physiological aspects and changes that happened during the hyperbaric therapy, such as improvement in the circulation, improvement in the blood utilization, and in the brain in the periphery. So, in conclusion, we can say that as far as the blood glucose levels go, there seems to be no difference between a hyperbaric oxygen therapy session and a simple 4-hour fast in normobaric conditions. And I would like to say thank you for the listening, and a big thanks to Shai Efrati for the support during the years, and to the staff of the Hyperbaric Institutes that welcomed me like a family. Thank you very much.
Thank you, Ronit. One question. Although it's a very small study, do you have any difference between insulin-dependent patients and oral anti-hypoglycemic? Can you see?
I still don't know. Didn't analyze.
Because
I'm waiting for the whole group.
Because what we are afraid is from hypoglycemic event during the treatment. Those patients on insulin are more prone
to that. Yeah, but we had, I think most of the patients with diabetes were on insulin therapy, and we didn't have any hypoglycemic effect in these patients.
Okay. Any other questions?
I noticed you noted a decrease in blood glucose in the control and in the hyperbaric treated. I was wondering if the decrease in blood glucose that you saw kind of correlated with the postprandial rise and fall of the curve typically seen when someone eats it. Like if you measure my glucose now and then an hour or two later it'll be lower, just because the body is being depleted of carbohydrates.
This is exactly the explanation that we used. Okay. We didn't measure for the first 2 hours. We measured 2 hours postprandial. We started the evaluation and it lasted for 2 hours. So basically it's 4 hours. So the immediate effect of the hyperglycemia wasn't measured because we started the measurements 2 hours after the meal. Okay.
Any other questions? No? Okay, thank you.